So, hello everyone, myself Vallari Nisargand, and I would like to welcome you all to an enlightening session of Health Katta, where we aim to raise awareness related to health in the community. Firstly, I would like to introduce you all to our organization, JPF, Jnana Prabodhini Foundation. JPF is a non-profit organization and was established in 2019 by some alumni and associates of Jnana Prabodhini. Over past 4 years, Jnana Prabodhini Jnana Prabodhini Foundation has grown remarkably with global network of 750 plus individuals and 100 plus active volunteers. Presently, we are driving 8 projects, one of which is IBRETA. This is an initiative in the field of biological sciences which encompasses areas of research, education, training, and awareness. IBRETA aims to fulfill the gap between the medical community and the research community through the interdisciplinary and collaborative research. Further, to create awareness about health by reaching communities and to inculcate scientific mindset among the young students. IBRETA approaches to fulfill the aims through 4 main domains, that is research, education, training, and awareness. Further, I would like to show you some of our awareness sessions that were conducted. You can always go on our YouTube channel and watch out these sessions. Further, I would like to show you some training sessions which were conducted last year. Now coming back to our today's Health Katta session, it's my pleasure to introduce our guest, Dr. Mridula Apte. With experience of 28 years by her side, she brings a unique blend of expertise, compassion, and dedication to her practice. Trained at prestigious NIMHANS Bangalore, she holds a PhD in clinical psychology from SP Pune University. Throughout her career, she has not only provided clinical care but have also been deeply involved in research and training, shaping the next generation of mental health professionals. Her contribution extends beyond clinical settings, with affiliation with renowned hospitals such as Vimhans, Fortis, Apollo, as well as engagement with corporate setups, schools, colleges, and NGOs. What truly sets our speaker apart is her vision. She is committed to not only owning the clinical skills of future psychologists, but also to making mental health services more accessible and economically viable to every one of us. Her dedication to this cause is evident in her proficiency across the domains, including psychotherapy, counseling, psychometric analysis, and testing. Today, we have this privilege to learning from someone who not only understands the intricacies of human mind, but who also possesses the wisdom and compassion to guide us towards a brighter and more inclusive future towards the mental health care. I would like to hand over the presentation to Dr. Apte, and Madam, please start teaching us. We would like to learn a lot from you.
Thank you so much, Valerie, and thank you, team JPF-IBRETA. I think it is great that all of you have thought of mental health and especially neurodevelopmental disorders like ADHD as a priority to create awareness, because it's very important in our country, as ADHD does not have a disability status yet. And therefore, there are a lot of people who are campaigning for this status. And if we do get that status, that will be great. A lot of people who come to us with various mental health concerns often have a missed ADHD in their childhood, something that has not been diagnosed. And then they come in with a lot of other issues, and then we find out that they have ADHD, and then it becomes even more complicated. So thanks a lot for making this a priority. Okay, so I'll start my presentation with a story of a person called Kala. So I'm just going to read this presentation, this case to you, and I want you all to, if possible, make a note of whatever you feel are the characteristics of ADHD in this particular story. So Kala is a 29-year-old married woman, a school teacher in a primary school, and she stays with her husband and in-laws. She came to the clinic with symptoms of anxiety, palpitations, worries, brooding, and an inability to keep everyone happy. Since her childhood, she found that people have been disappointed with her. She wasn't good at academics. As she loved her parents a lot, she would often lie to them saying that she has passed in her exam, just to see a smile on their face. Instead, they would punish or hit her. She understood everything in class, but she got so bored sometimes that she would try to cheer herself up by talking to people, even helping out other children. But the teachers would reprimand, saying that she is not completing her work and distracting others. Her legs would ache sitting in one place for a long time in her coaching class. And then she would say that rather than distracting other children, let my mind wander off and I'll daydream about something nice. But then here also, there were complaints that she was always lost. Can we go to the next slide? Kala did not know what was okay finally. Her siblings were always better than her in their studies, in making friends, and in making people happy. Somehow, after much scolding and disciplining, she completed her basic education. Her marriage was fixed with Rahul. He liked the way she chatted a lot and that she was so helpful. However, soon he also started getting angry. The housework wouldn't get done according to his wishes, and the family had to wait until meals arrived on the table. Kala was trying to be perfect actually, but here also she didn't manage. We have the next slide. Kala made a few friends in her new workplace. She joined a school job and thought it would be fun. Kala likes a lot of fun and interesting things. She worked very hard in the first month, and the children loved her. She was fun to be with, and she used new, innovative methods to teach them. However, after a month, she started getting bored and disinterested. She wanted to leave this job and do something else, but her family asked her to continue. Small tiffs started happening with her friends also. They loved her, but they thought she was too talkative and short tempered. Eventually, Kala started feeling very bad about herself. She had low self esteem and she started losing confidence. Now, this particular story that I have presented is a very typical story in a very typical Indian socio-cultural context. So, some of the things you might get irritated with, some of the things you might not like, but this is how things are in most places. Okay, so now we can understand more or less what a dilemma Kala is in from Kala's perspective and also perhaps from her family perspective. So let us try to understand now what are the diagnostic criteria of ADHD. Probably at the end, we'll again revisit Kala and see how we can help her. So we have two classification systems in psychiatry. One is the DSM and one is the ICD. The ICD is the International Classification of Disorders, and it is made by the WHO, and therefore it comprises many countries. And therefore, I have used that classification. ICD-11 is the most recent version. So ICD-11 defines ADHD as a persistent pattern, at least 6 months, of inattention and or hyperactivity impulsivity that has a direct negative impact on academic, occupational, and social functioning. Significant inattention or hyperactivity impulsivity symptoms are there before age 12. Now, I'll just explain these things to you a bit. Let us remember that all of us face inattention sometimes. So, how is ADHD inattention different from other inattention? Whenever we do any task, we have a goal in mind. Okay, so it is a very goal defined task. and therefore being able to sit through a task and complete the task, reach the goal is what we are supposed to do. Now, most of these tasks that we do in our lives are not always interesting tasks. Okay. So, can we again have that earlier slide, Pallavi? Yeah. Yeah. Keep it at this slide. So, most of the tasks that we do, for example, some part of our studies may not be interesting, some part of our jobs may not be interesting, but we have to do it and we have to pay attention and complete the task. So, inattention refers to lack of attention in tasks that may not be immediately rewarding or interesting or fun. Okay, so inattention in those tasks is what we are calling inattention over here. Similarly, hyperactivity is not overactivity or multitasking. Hyperactivity is inability to reach the goal. So there is a lot of activity, but that activity is not reaching the goal. Okay, so suppose I'm supposed to do something, I can do 10 other things, get distracted everywhere, but not able to do what I'm supposed to, right? And impulsivity is, of course, acting without thinking about the consequences or risks, right? Now, why is it diagnosed by the age of 12? There are a lot of children who develop hyperactivity. Most children have hyperactivity, it doesn't develop over time. But there are some children who develop hyperactivity due to brain injury or brain damage or epilepsy. And these are the children who have to be accommodated by this age. Also, sometimes hyperactivity is not noticed till a much later age because when children are very small, sometimes they are thought of as naughty children, or it is thought as if parents are pampering them excessively, or there could be a joint family and this hyperactivity just goes unnoticed. And most of all, a lot of parents and families do not know about ADHD. So it is passed off as bad behavior, they are punished for that bad behavior, and life goes on. Till the time they come to school, again, there are some complaints. Till the time they come to serious studies, which is around primary school, that is the time complaints become more and more serious. And therefore, the age is set at 12 for diagnosis, a complete diagnosis of ADHD. And symptoms have to develop before this age if you have to be diagnosed with ADHD. And we have the next slide. Yeah, that's right. Uh, Now, the sometimes in some children there is more inattention. In some children there is more hyperactivity, impulsivity. So, according to that, the types of ADHD are given. So, we have either an ADHD inattentive type, or we have a ADHD hyperactive type, or we have a combined type of ADHD. Similarly, according to age, according to the course of development, certain symptoms decrease. Hyperactivity, for example, is known to decrease a bit over time. Inattentiveness remains, distractibility remains, restlessness decreases or it takes a different form. So these ups and downs keep happening. Also, sometimes some children and some adults are hyperactive or inattentive and distractible in certain situations, not so in other situations. Or they are especially troublesome to their parents, for example, when they are children, but they are okay in school, they are okay with their friends. In this case, it is a behavioral problem and not ADHD. So, ADHD has to be present in at least two or more situations. So, these are the four important characteristics or diagnostic criteria. Can we have the next slide? Okay. So the diagnosis of ADHD, like I said, there are three diagnoses of ADHD. There are three types of ADHD. So how do we make a final diagnosis? First, we go through the diagnostic criteria with the parents and with the child or adult. So even if you have an adult who has missed a diagnosis in childhood, if possible, go back to their parents to find out the behavior in childhood, kind of academic performance, emotional issues, complaints from school, everything, the whole criteria that has been given in your ICD or DSM. You have to go through that. If you do not have access to their parents, then only the clinical interview of the adult will be important. Where assessments are concerned, sometimes medical assessments are important. Some medical conditions mimic ADHD, like thyroid disorder can mimic ADHD. So some medical assessments have to be done. There are sometimes some vitamin deficiencies because of which ADHD can increase. It cannot be created, but it can increase. And then there are psychological assessments. So we will go through the psychological assessments. But most children with ADHD and adults with ADHD have what we call as neuropsychological deficits. So we have to assess them for these deficits to be sure that uh, they have ADHD and what are the levels of deficits that they have. And the family members informants interview, which I talked about. Can we have the next slide? The psychological assessments for children normally are intelligence batteries. Now, over here, we are not really trying to look at the intelligence of the child. What we are trying to see is neuropsychological issues like attention, memory, etc. For children, though, there are a lot of other attention and memory tests. An intelligence test is used as a neuropsychological test battery for children. Also, some intelligence tests have verbal and performance batteries. And the difference between verbal and performance uh, intelligence quotients is often a very good measure of assessing ADHD. As you can guess, the verbal performance of children with ADHD is always more superior to the performance quotient. There are parent and teacher rating scales. There are tests to understand behavioral and emotional problems. And there are tests to measure learning issues and difficulties. All these tests may not tell us whether the child, may not screen the child for ADHD, but also screen the child for what we call as comorbid issues. So, issues that are likely to be there along with ADHD. For adults, we do some parts of neuropsychological test batteries to measure functions like attention and memory. We use self-report measures, and we use also other tests, other psychodiagnostic tests to measure or to check for comorbidities. We have the next slide. Now, in the Indian population, ADHD is not any different. So the characteristics of ADHD, whether it is in India, whether it is anywhere abroad, is the same, primarily because ADHD is a neurodevelopmental disorder. It is it is not because of upbringing. It is not because of any kind of diet or lifestyle or anything like that, or weather. So it is there is no different Indian subtype for ADHD. It is the same. Sometimes presentations become a little different in terms of the socio-cultural context. So sometimes children are missed out as having ADHD, or some children, especially boys, I think world over, are diagnosed with more ADHD, um, and girls are the diagnosis for girls is often missed out. Sometimes a diagnosis for boys also tends to get missed out because a boy is valued in the Indian culture a lot and is also pampered a lot, and therefore often has a lot of behavior problems in childhood. So the diagnosis gets sometimes missed out because of that as well. Um, the prevalence of ADHD world over is very variable. Some countries quote 4 to 5%, some quote 8 to 10%. So in India, some prominent studies have quoted about 8% prevalence of ADHD, but it is really very variable, and there are a lot of undiagnosed ADHD children. So there is misdiagnosis, missed diagnosis, and difficulties in seeking help. Difficulties in seeking help are there because of lack of awareness. One doesn't know where to go, and lack of specialized treatments as well. Then there is, let us look at the school involvement and concessions. In rural, semi-rural areas, we do not really find many people who know about ADHD or who feel that ADHD is a problem. But in the metro cities or in larger cities, uh, very often teachers at least send children with uh, hyperactivity, with inattention to the school counselor, after which then testing is done and a diagnosis is made. And after a diagnosis is made, schools do offer concessions in the form of more time for writing papers. We as psychologists suggest a host of things to the teachers. For example, we suggest children sitting in the first row because attention is always better when there is lesser distraction. No, so if they sit on the first bench just in front of the teacher, they are likely to be less distracted. We also suggest smaller chunks of information or smaller chunks of tasks that they have to do, unlike other people who are given other children who are given bigger chunks. So they can be rewarded or acknowledged after smaller chunks. They are also encouraged to have um, more breaks. So if the teacher can formalize the breaks, saying that become a water monitor or a chalk monitor, or get the notebooks from the other class. All these kind of activities are used as a reward for completing the small chunks of activity. The child with ADHD will be very happy and very focused. So these kind of concessions are given, but unfortunately only till school is over. Once school is over, even in the board exams, children with ADHD get a concession. But after school is over, there is no concession. There is no flexibility in terms of the amount of work done or the amount of time taken or given, etc. However, if a child with ADHD also has a learning disability, then definitely a writer can be provided, certain subjects will be waived off. So that is definitely done. So learning disability is recognized as a disability and there are many concessions. There is a lot of stigma with ADHD, uh, and especially when ADHD is not diagnosed. So with the diagnosis and with proper education and awareness, probably stigma will decrease. But currently, there is a lot of stigma because people with ADHD are perceived as people who are over talkative, not being able to complete work, getting angry very soon, having relationship issues, making a big deal out of nothing, attention seeking. These are the kind of labels that people with ADHD are thrown labels at. And people who do have ADHD often feel that, I was just trying to help out, or I don't know where I went wrong, or maybe I am the problem. So they don't really understand till the time they are diagnosed. They do not understand. I have seen people becoming really happy when the diagnosis is made because then they know where to place all their troubles into, which basket to place their troubles into. So it's very relieving to get that diagnosis sometimes. And then the treatment options also open up. And we have the next slide. Yeah. Um, Causes and contributions. Now, since it is, like I said, neurodevelopmental, it is not due to bad parenting. It is not due to um, the way your parents are, or the way you have observed your parents, or something like that. It is not because of being with another ADHD person. Nothing like that is happening. Definitely, parents who have ADHD as a condition, or families who have a genetic loading of ADHD, are likely to have children with the similar condition. So there is definitely a probability of some neurodevelopmental disorder passing on. Then the brain is a little atypical. It is a little different. We'll come to the details of exactly what is there that is different. Uh, Premature birth, maternal drug use, low birth weight, epilepsy, any kind of brain injury or damage, and exposure to toxins like lead have been implicated, and they can be contributory factors to ADHD. Okay, so can we go to the next slide? The ADHD brain is a little different. For instance, the prefrontal cortex is smaller. Because of imaging studies, and all of you are people from the biological sciences, you will be able to talk about this much more than I can. But thanks to the imaging studies, so much we are able to observe now and understand about the ADHD brain. So the prefrontal cortex is smaller, and the prefrontal cortex, like we know, is responsible for executive functions. Other implicated areas are the anterior cingulate cortex, posterior cingulate, smaller basal ganglia, which is responsible for memory. Now the connections are a little atypical. Okay, some connections are not very strong, and some connections are atypical. Also, there are increased levels of neurotransmitter dopamine transporters. Now, dopamine and norepinephrine are neurotransmitters that are responsible for not just good mood, but also attention and concentration. So, if dopamine is not allowed to remain in the nerve cells for long, then there is a possibility of us not having adequate attention concentration as well as uh, good mood or elevated normal mood. So these dopamine transporters, they tend to uh, remove the neurotransmitter discharge from the brain very fast, and that is why they don't allow the dopamine to remain in the brain for long. So the increased levels are a problem, and that is why there is a use of antidepressant medicines also in the treatment of ADHD. There are overactive DMN, or a default mode network. Now, a default mode network is a combination of many brain regions, and this network is active when we are not doing any specific task. For example, there is no goal directed activity, and we allow our mind to sometimes wander off, we daydream, or we reflect upon ourselves, or we can notice the changes in our environment that are happening. So we allow ourselves to be distracted. We are not focused all the time, and we notice our environment. We are in a different zone. Now, the DMN is overactive in a person with ADHD. The person with ADHD is unable to focus on a task because the DMN mode is active even when a specific task has to be done. So while the person is doing the task, the person is distracted and is self-reflecting, is daydreaming, is looking at things that are changing in the environment. So can get distracted very easily, and therefore is unable to complete tasks, is unable to is generally very slow at completing things, is unable to be consistent with things. Okay, right. Can we go to the next one? Now, these are so many comorbidities. Comorbidities are other disorders or other mental health conditions or other medical conditions that are present with ADHD. Okay, or they can be like ADHD, and therefore we can get confused. So, thyroid disorder is not a comorbidity, but thyroid disorder can mimic ADHD. Absence seizures, which is temporal lobe epilepsy, uh, wherein children or adults can just zone off for a few minutes or a few seconds also. It's a kind of a seizure. It's not because they are zoning out because of lack of attention. Okay, so it's a seizure. It is noticeable on EEG, and it is kind of epilepsy. Okay, so absence seizure sometimes looks like ADHD. It is not ADHD. Now, anxiety disorders, OCD, mood disorders, all kind of externalizing disorders. Externalizing disorders are disorders where the child is acting out. So the child is trying to, the child troubles other people, or the child is disturbing to other people, the child is defiant, or the child is having some kind of behavioral problems. So these are all externalizing problems. And because externalizing children, externalizing adults are noticed more often, they are disturbing to other people, and therefore there is a lot of stigma also. Their anxiety disorders, for example, is an internalizing disorder. It doesn't trouble other people. So people who have a lot of anxiety, till the time you know the person very closely, you will not be disturbed by that person. Okay? And therefore they are not even noticed sometimes. So anxiety disorders are called internalizing disorders. While ODD, that is oppositional defiant disorder, or conduct disorder, or ADHD, are all considered as externalizing problems. People with ADHD are also vulnerable to all types of abuse, like sexual abuse, because they are high risk taking, they're very curious, and they are likely to, they don't get scared so easily. So they are likely to venture into things, they are not likely to look at the consequences. So it's not as if they are doing it to themselves, but they are unable to gauge risks, and therefore they are more prone to, more vulnerable to all kinds of abuse. They are also prone to substance abuse because a lot of substances tend to calm them. So till the time they are unaware that they have ADHD, or till the time they are not on treatment, they are likely to abuse substances. Even after that, some people abuse substances. Other neurodevelopmental disorders like learning disability, autism spectrum disorder can sometimes coexist with ADHD. Trauma related issues like dissociation and memory issues sometimes mimic ADHD. They are not always comorbid, but they sometimes mimic ADHD because trauma sometimes creates dissociative like spells. One tends to again zone out, one is out of touch with reality for a brief while. And this might seem as if the person does has an attention deficit problem. Okay. Can we go to the next slide? So adult ADHD is a missed diagnosis in childhood. They do not come to our clinics for the ADHD. They come to us for depression, for anxiety, for OCD, for some other comorbid issue. Then a lot of people ask us whether we outgrow ADHD. So the answer is no, we do not outgrow ADHD. Earlier, I practiced for many years. So earlier, there was a theory that many percentage of children outgrow ADHD, and there is a brief percentage of children that continues to adulthood with the ADHD. But that's not true. ADHD changes the picture, changes the presentation, but ADHD doesn't really outgrow itself. It remains. Is there something called hyperfocus? Yes, sometimes um, when people who have ADHD, or any of us, in fact, when we are focusing intensely on a task, we are said to have hyperfocus. So, do ADHD people specifically have more hyperfocus? I think hyperfocus is one of the compensatory or accommodating um, ways in which they cope up with their problem. So a lot of people with ADHD tend to super specialize or have their niche areas and try to become successful in those areas. So that can be a hyperfocus. Um, they do have divergent and out of the box thinking, and they do have higher risk taking abilities. So they are not necessarily creative. Like I said, the condition by itself makes them think out of the box, think differently. They tend to zone out more often. They tend to observe the environment in different ways than neurotypical people do. And therefore, sometimes they do come up with creative solutions. So we find that in a structured environment in school, if the ADHD child is not really the most favorite, but as they grow, they can be really sought after for their different ideas, or for their uh, very socialness, or for their being very interesting also. So uh, there is an advantage in that sense, if we can say. Can we have the next slide? These are the regular problems that a person with adult ADHD will have. There are educational and occupational impairments. They are unable to hold jobs. They are unable to complete tasks. The main thing is unable to plan, organize, manage time, prioritize. These are the typical executive functions that they miss out on. Because of this, also they have problematic relationships. They are impulsive. They're not willing to really listen out somebody for a long time. They're also not able to understand very quickly or empathize very well with what exactly the other person is feeling. However, they are very sensitive to what is happening inside them. So they understand their deepest emotions very intensely. But it's very difficult for them to understand what you are saying if you don't express it very clearly. So if you sulk and sit in a corner, they will not understand why you are sulking. But if you tell them very clearly, this is what you did, this is what I did like, and therefore I'm sulking, they'll get it, and probably they'll be very empathetic then. Managing daily routines again, because consistency, boredom, monotony sets in. Coping with problems in daily life, and there are elevated risks of substance abuse and risky behaviors. Can we go to the next slide? I'll quickly go through this. In children, the management is very nicely organized by now, so the whole team works with the children, the school, the family, and many professionals. Sometimes a classmate is made as a buddy to help the child to navigate through daily life, school life problems. Psychostimulant drugs are given to children to help them work and function better. Family therapy, behavior therapy, remedial education for their, so correctional kind of education, different kind of education to help them study better. Uh, Most children with ADHD get bored to write, get bored to complete tasks. So a special educator normally helps them to study in a different manner so that they get less bored, they can study with small chunks of information, and they learn to do well in their exams. And then there is occupational therapy. Occupational therapy helps to improve coordination, decrease impulsivity, and if there are any sensory motor issues like becoming clumsy because of the hyperactivity, that is also managed. If ADHD is noticed in childhood, it is really fantastic, because then that is the developing or the growing brain. So we all know the principle of neuroplasticity. We can develop newer and stronger connections if we learn different things, learn different management strategies. So just imagine a child learning these different things and growing up is definitely going to have lesser problems as an adult. Okay. Can we go to the next slide? Right. Now, I've just given a model of cognitive behavior therapy in ADHD because I thought at a glance you will come to know how, as a psychologist, we manage ADHD. So these are the core neuropsychiatric impairments which in a adult can be in attention, inhibition, and self-regulation. On the left, we have a history of failure, underachievement, relationship problems, which can lead to negative thoughts, negative beliefs, which leads to, of course, self statements like I'm useless, I don't deserve to live, very, very sad self esteem issues, which can lead to mood disturbances like significant depression, guilt, anxiety, anger, which again leads to a failure to utilize what we call as compensatory or accommodating activities or strategies that can help you to deal with the ADHD. So both the neuropsychiatric impairments as well as all these other issues are finally leading to functional impairment. So what does the adult need to do? The adult needs to learn to organize, plan, manage time, prioritize. Okay. So if these things are taught in great detail, uh, or if the adult is handheld to manage these issues one by one, slowly, slowly, at the same time managing the mood and the emotions, because that will go hand in hand, then we have achieved a good psychotherapy model with the adult ADHD person. Can we go to the next slide? So, in short, the management of adult ADHD is done with medication. Uh, Many kinds of antidepressants are also used. Psychostimulant medication is also used. Medication doesn't always help completely, but it helps partly. Psychotherapy to accept and understand the condition takes time. There is, like I said, they are happy to know that they have some condition, but then there is also a feeling of, with any kind of a chronic condition, nobody is going to like it. It's going to take some time to accept it. So working around and accommodating the ADHD, because they've suffered so much with the ADHD and also the missed diagnosis for so many years, that they have already developed a very poor self-esteem. So we have to work on the self-esteem. However, there are many adults who have had very attentive and mindful parents, parents who probably missed the diagnosis of ADHD, but they have been helping the child to manage with many accommodating strategies. And these are the children who tend to become high functioning. So there is no real thing as a high functioning ADHD or a high functioning autism spectrum disorder person with ASD. But any of us can be high functioning when we, despite our problems, can manage to become functional. Okay. Can we have the next? So Barclay was the person who talked about ADHD many years back. He was one of the first experts on ADHD. So he said ADHD is not a matter of knowing what to do, but of not being able to do what you know. So most people with ADHD are really bright and they know that something is wrong and they need to correct it, but they're unable to help themselves. Okay, so this is where we are, and this is what I end my presentation with. But you can always ask me questions with regard to our story about Kala and anything else that you want.
Thank you so much, Dr. Mridula. That was very informative and engaging. I really like the start with a story because I'm sure everybody can connect to one or other points. We might have seen somebody behaving that way. And I'm sure it will help everybody who is listening to this video to help whoever is going through any of the issues. We actually have a question answers in like kind of two parts. We'll start with some of the questions that we have from our audience that we asked, like what they would like to know from you. And then we kind of have a fun round with rapid fire because there are a lot of truths or myths, 0% to 100%. And we would like you to like kind of do like whether it's a myth or a truth, to what extent. And if you feel like if that's a more important of an topic, then you could also elaborate on that. And then we'll again follow on some of the questions with what you have told us today. I'll start with maybe like diagnostic part because that's the main key. If you don't know you have ADHD or your children have ADHD, then there's nothing that you can do. Since you mentioned that the brain is something like its anatomy is something that you can check, we have a couple of questions regarding that. How early you can diagnose ADHD? And can you do prenatal diagnosis of ADHD? And are there any differential diagnosis between children ADHD versus adult ADHD?
Right. As of now, I don't know about any prenatal diagnosis of ADHD. Uh, Children with ADHD are, there are studies showing that children with ADHD are difficult children. You know, they cry more, they are more cranky, or they have sleep difficulties. But there is yet no complete research on that. You know, so we cannot say that all cranky children or all babies who are difficult babies will develop ADHD later, but those could be initial signs. However, once the child is growing, I would advise as a psychologist that if you have any doubts, even if it is a false positive, as early as 2.5 years, do visit a mental health professional or a developmental pediatrician and get an opinion and monitor your child. It could be nothing, but it is much better to go through that. That's what I would advise. Differential diagnosis with children, ADHD is more pronounced. It is most pronounced when they are about 5 to 8 years of age or so. You know, they are really the maximum problems happen at that time. But as age progresses, children learn to mask their ADHD. So if they are hyperactive, also adolescents would like drum their fingers or they would move their legs, but they would not really run around the room. You know? So they learn to mask, and hyperactivity is known to decrease over time. So definitely that is the difference between adult and children.
Okay, thank you. Then you talked about different drug treatments that are given, and one of the things that people are worried about, are there any side effects that you see with different medications, especially considering that there are comorbidities with ADHD?
As far as I know, and I'm not a psychiatrist, but as far as I know, psychostimulant medication does not have too many side effects. Also, psychostimulant medication is not given for years together, uh, till the remedial work kicks in and the child starts to learn how to manage on their own. Psychostimulant medication is given. Also, sometimes psychostimulant medication is given to adolescents and adults just a few months before the examination so that they can complete their examination with more concentration and attention, etc. Um, Antidepressants are sometimes given for a longer duration in adolescents and adults because they have other comorbid issues as well. So, they, all medicines have their side effects, but none of these medications have very severe side effects or very long-term significant side effects.
Okay, that's good to know. The next thing, where I think you touched upon it, that ADHD is mainly neurodevelopmental disorder, but because they still have to live their life in a better way, we had a bunch of questions with respect to how lifestyle factors affect ADHD people to live better. For example, diet, exercise, could be meditation, or because of your diet, how gut microbiology gets affected. If you could touch upon that.
Definitely. So, though all these issues do not cause ADHD, like for any other health concerns, a good lifestyle, a routine, and a good diet and good sleep will definitely help you to manage ADHD better. Simply because a good amount of sleep is going to help you to concentrate better. Your mood will be better, and therefore you're going to have much more energy to go through the day. So similarly, I think your diet will matter. There are a lot of questions about whether you know fertilizers or other toxins and they affect and contribute to ADHD, and there is some evidence supporting that. So definitely, if especially if you're planning to have a baby, and it's much better to have a healthier lifestyle and be away from these things as much as possible. Also, I think it's important to note that screen time can actually not allow you to utilize your compensatory mechanisms or strategies very well, because screen time means very novel visual stimuli all the time. So there is no question of being able to concentrate for a long time because there are new stimuli all the time. So a lot of children with ADHD, a lot of adults with ADHD especially, are likely to get very addicted to the screen or to gaming or to other screen related issues very fast. So definitely keep away from screen as much as possible.
Right.
But yet you have to use your apps and gadgets so that you can manage your ADHD. It's a difficult balancing act actually.
Absolutely. Um, and there's like one interesting question. So because different, as you mentioned, socio-cultural background, or how people are around you affects how you behave, or like how you change. Um, we were wondering how COVID pandemic affected ADHD. One, because of the infection itself, and we didn't know much about the disease. And second, there were a lot of changes in the social structure or interactions during those 2 years. Did you observe any change in people who approached you, or diagnosis, how much it got affected?
ADHD in particular, I don't think was affected by COVID, but a lot of comorbid issues like anxiety, depression definitely were affected. In some funny ways, they were. I think people were positively impacted because people who had an anxiety issue or people who couldn't complete tasks on time got a lot of time to complete them. They could sit at home and do a lot of work. They didn't have to face people or face very strict deadlines. So I think in some ways, for people with mental health concerns, uh, COVID actually helped also. I mean, it didn't all. I mean, it didn't all not help. And in some ways, of course, since people with mental health issues and with neurodevelopmental disorders are more vulnerable, so definitely they got a tad more anxious than other people. They got more depressed. They got more worried. And if they had small businesses or if they had with great difficulty got a job, then it was more difficult for them now to again start and try. And so that was a very big problem for them. It was very sad.
Mm, right. Um, there was one more question about like different therapies that are suggested for ADHD. Currently, music therapy is something that's been out there for various, say, sleep disorders or anxiety. How much does it affect ADHD? Do you recommend people? Are there any specific genres that you would suggest or not suggest for people with ADHD?
I'm not particularly aware of how music therapy would help, but there is a lot of research going on even at NIMHANS on music therapy and mental health concerns. But I'm not really, I am not aware about it.
Um, and maybe to wrap up this part of question answer session, can you give examples of some inspiring people who had ADHD or like were diagnosed, they accepted and they actually took further steps to make sure that their lives are not getting affected because of it, either in your personal experience as well as some people that we know.
Right. There are a lot of celebrities who are known to have ADHD. I really don't know whether they really have ADHD or not. So I will not talk about any of them. But and I cannot talk about any of my clients either for the sake of confidentiality. But what I can say is that I can see a lot of people with ADHD amongst my clients in the general society, and I find them being accommodated very well by their families sometimes as having a temperamental problem or they're just being accommodated, especially in bigger joint families. They're just being accommodated, and a lot of other people are suffering because of their short temper or their issues, but they are not being not attended to. So in that sense, it's very good. But definitely, if there is more understanding, for example, uh, suppose a ADHD person is in a relationship with somebody. Suppose it's a husband and wife, and the husband is getting angry all the time, and the husband has ADHD, which is undiagnosed. Okay, then the wife will probably is likely to feel that the husband is purposefully doing it or doesn't understand what she needs or something like that. While and she is not expressing this because she probably thinks he knows why he's doing it and why he's behaving in a particular manner. But if she knows that he has ADHD and he's unable to stop blurting out certain things because of the impulsivity or use certain words because he just can't help it, then probably everything will be different. It is not that the wife has to tolerate everything that her husband does, but then at least she will understand that the intentions are not bad. The intentions are probably to do something good for the family, but he's not able to because of the way he talks, because of the way uh, he faces his issues. Okay, and then the wife can actually limit set and say, okay, these are your problems. I'm going to tolerate this much. I'm not going to tolerate this much. So there can be limit setting if she knows his problem. Okay, so things can change. So I have seen some couples, some parents actually make this change, and lives are much better. So this can happen, and then everything can change. I mean, the upbringing of their children will change. The whole family will be have a much more conducive atmosphere. So many lives will not get affected if ADHD is detected and uh, accommodations are made for it.
Yeah, that's good. So definitely will keep your advice in mind and then make sure that we are also open when we hear someone tell their problems or like approach it in a positive manner. That's good.
Right, right.
And now let's move on to our fun rapid fire part. It would kind of be summarizing as well what you talked about and what we found out about ADHD, and everybody who has been Googling ADHD and would know if that's true or not, whether they should believe it or not. And so over to you, Krishna.
Hi, so I've list of some sentences or common notion that are believed to be true or untrue about ADHD, and I just want your insights to identify which ones are myths and which ones are true. So first one is that ADHD is overdiagnosed.
No, it is not
Okay.
overdiagnosed.
So the second one is ADD can be managed by planning and following a schedule every day.
More or less, yes, but only this much will not help.
Okay. A woman with ADHD does not exhibit signs of hyperactivity.
Because of socio-cultural backgrounds, sometimes hyperactivity is seen less in women. However, definitely in comparison to men, they have more inattention issues. Yes.
Okay.
So it's yes and no.
Moving on to okay. So it's myth and truth both. Cool.
Yes.
The next word is ADHD results due to watching television or playing games for prolonged time.
It's a myth.
Okay. The next one is that ADHD is manageable with drugs.
To a certain extent, it is manageable with drugs, but only drugs won't help.
Okay. The next one is that when suspecting ADHD, it is important to seek medical help.
Yes, true. That's true.
True. The next one is that mobile apps designed for ADHD can actually help manage the condition to a certain level.
Mobile apps do help to manage ADHD well. People with ADHD do use assistive mobile apps. There is no problem in doing that. Only you should not get overwhelmed with the apps by themselves. While treating
Seems fine.
ADHD, regular administration of results in substance abuse, not really. If the ADHD drugs are given under strict supervision, then definitely it will not result in substance abuse. But because the medication for ADHD is psychostimulant drugs, a lot of people fear that it will result in substance abuse.
Right. Moving on to next one, it says all kids with ADHD perform poorly during their academic years.
Yeah, yes, that is in a way, it's not all kids, but a lot of kids with ADHD perform poorly during their academic years, but not all. Like I said, there are some parents and schools who are, even if they don't know that the child has ADHD, they are particularly mindful and they will help the child in a structured environment to do well. So it's a myth and truth both, because it's not all, but most, yes, most will perform poorly. I agree.
True. So can we ever like come across somebody who has ADHD but also an overachiever? Is that possible?
That's absolutely possible. Because a lot of people with ADHD sometimes, like I said, choose a niche area and they hyper focus and work in that area very well. So there are a lot of people who can be high functioning and who do very well. They may not be able to manage some other areas in their life, but they can be high achievers. Taking stimulants or depressants is not always necessary to manage the symptoms of ADHD. Well, I would say it is necessary. So this is a myth. Um, Definitely, we will need some medicines.
Right. The next one is that period cycle interferes with symptoms of ADHD in women.
Right. I think per se, the menstrual cycle will not interfere. But like I said, people with ADHD are vulnerable. So any kind of medical or psychological issues will trouble them a little more than they will trouble other people. Okay. So ADHD symptoms are known to increase more during PMS or at different points of the ovulation cycle. So
Right.
symptoms are being able to concentrate well, these are the kind of problems that will increase. While other
Right.
women can have things like irritability or fatigue or mood swings, the kind of symptoms for a woman with ADHD could be lack of concentration, not getting work done, poorer attention span, so along with the other usual.
Okay, makes sense. The next one is that ADHD results due to bad parenting.
No, definitely not.
The next one is people with ADHD are always distracted.
Not always. Sometimes they are able to focus. There is a lot of scatter. It's up and down. It's very fluctuating. Their overall results in school are also very fluctuating. If they find something interesting and fun, they can do very well in a particular subject. So there's going to be a lot of scatter. You might find maths very poor and biology suddenly great. So, and then the next semester will be just the opposite. So that is absolutely possible.
Okay, so it fluctuates always.
It fluctuates their interest level.
Right. The next one is that online tests can actually help you in recognizes if you have ADHD or not.
No, I wouldn't trust the online tests completely. No, that's a myth.
Right. Next one is that, okay, yeah, I think you just mentioned it a lot of times, but again, it's there, so I'll just state it. High functioning ADHD is real.
High functioning, anything is real. So any person can be high functioning, whether the person has a neurodevelopmental condition or not. So high functioning is not a technical term. It is not a term that we would use in our diagnostic classification, definitely. But any person who has learned to manage ADHD well and has high intellectual capacity is definitely a high functioning person.
Right. The next one is we all have some symptoms of ADHD, but if you're clever enough, you can overcome them.
That's a myth. We all don't have
Right.
symptoms. It's a spectrum, but we all are not on the spectrum.
The next one is ADHD is just a genetic disorder that differs. Sorry.
ADHD can be genetic, but it is not always genetic. So myth and truth.
Right. The next one is in front of my eyes on screen. It says medication prescribed for ADHD can alter your personality.
No, it cannot alter your personality. Your personality will remain as it is. It can alter your behavior, because of which you are calmer, you can focus better, you can deal with people better. So it seems as if your personality has changed.
Okay, makes sense. And I think the last one is that people with ADHD are extremely intelligent or creative.
Not, I mean, intelligence is spread over for everyone. I mean, if anybody who is either who has ADHD or who doesn't have ADHD can be intelligent or creative. So I don't think ADHD people or people with ADHD are intelligent or they are creative. It's not like that. Having said that, people who have ADHD do tend to use creative strategies more often because of their condition. That is one of the coping methods, to use various creative strategies, to use innovative methods, because they get bored easily. And because they have problems, they try to compensate by using different creative ideas. So in that sense, you can say they are creative. But they are not more intelligent than other people. No.
True. And I think one that we missed, that's on screen, is it says people with ADHD struggle with poor self-esteem when their friends and family are not supportive of them.
That's true. That's true. Absolutely true.
So I think I'll hand over to Pallavi again. She might have some more questions about it. So go on, Pallavi. Thank you, Dr. Mridula.
Yeah. Thank you. We'll move to the second part of the question answer session. Mrunmayee, if you can take over.
Yeah. So, thank you, Dr. Mridula, for the wonderful talk. And I hope that at one point, all of us, we have discussed with our friends and we have thought about, oh, whatever we are reading on social media or whatever videos we are watching on YouTube about ADHD, do I have it or my friend, does she have it or something like that? So I hope that all of us who are watching this video or who will be watching this video will get some information about ADHD. And thank you for this informative and actually a fun session. So before we wrap up this session, I just want to ask you one question. It's in a two parts basically. So first is that if you're being asked to give three important tips, first for ADHD patients. So for any ADHD patient, what three tips would you give?
Okay. I would say, first of all, for an adult ADHD patient, I'm supposing. So for an adult ADHD person, I would say that choose a job or work that you like to do, that is interesting for you, because then you will be able to sustain your interest better. You'll be able to be consistent. You'll get less bored. Your attention is going to be better. So if possible, it's not always possible, but if possible, choose a job that you like. Then secondly, try to see if you can get flexible working hours, or if you can introduce some flexibility into your working schedule, so that you'll not get bored. And again, the goal is to remain consistent and to complete work. And third, try to work on organizing, planning, time management. These are things that are going to help you everywhere. Okay. So if you need to take help of other people, professionals, to do that, but do it. It's I think it's something that you should give it. You should give this a big priority. So these are the three things.
And second part of the question is the tips for like friends or the family of the patient so that they can support them or nurture them.
Okay. So I think one thing is a lot of parents, especially of children and even adults with ADHD, tend to feel guilty and blame themselves. They feel it is because of them that their child has ADHD. In some way, they tend to feel guilty. Either they feel that they are not behaving nicely with them, they feel sad. So first thing is not to blame themselves, not to feel guilty, because if they educate themselves and understand that this is a neurodevelopmental disorder, they'll be able to deal with it much better. Okay. So first is dealing with their own emotions. The second thing is educate yourself, become more aware, join groups or meet people who also have children with ADHD, so that you are able to share notes and become a support to each other. And the third is also, while you are helping your child or husband or partner or whoever with ADHD, try to also set some limits. So set some boundaries, set some limits, so that you take care of your mental health along with caring for them, and they also have a reality check, and they can also learn to work on those boundaries and limits that you have set for them.
Okay, so thank you, Dr. Mridula, for this wonderful session. And we actually learned a lot because ADHD is a very vast and a complex topic. And it's like what is ADHD exactly? It's always the question because you're listening to and reading a lot. But from today's session, we have learned how to diagnose and what are the treatments and whole lot of other things, and especially the myths and the facts part. So thank you for this amazing session. And before we end, I would like to say that IBRETA, have been hosting these different sessions since now 2 years, and all the sessions are on our YouTube channel. So if you like this session, then we have different sessions which we have already posted. So check them as well, and do like, share, and also subscribe our channel, and as well as follow us on Instagram, so that you will get to know about more sessions, more upcoming sessions in the future. Thank you all.
Thanks a lot.